The next inferior muscle is the infraspinatus, which is in the infraspinous fossa. You can trace the spine of the scapula here. So the supraspinatus is in the supraspinous fossa. The infraspinatus attaches broadly to the entire below spinous fossa. And it's difficult to palpate sometimes because the connective tissue overlying it, the investing layer of deep fascia, tends to be thicker here. Just like the fascia over the IT band or forming the IT band is thick, it makes it difficult to feel the underlying muscle. So often I'll spend a bit of time spreading the fascia over the infraspinatus. And then I'm going at cross purposes. The infraspinatus runs this way. So I'm scanning for taut bands within the muscle. And then when I get one, I can introduce a transverse force to bow the muscle. Because the roof is nice and relaxed, the fascial roof is nice and relaxed, the muscle's softening and responding very well to this. Whereas normally it takes quite a bit more attention to do that. As we're going out, though, things are getting really matted down, sort of in the middle stretch of the infraspinatus. So I'm taking some time with that. I can just slow my fingers down. Sometimes you want to get a little bit busier, not going so deeply, but introducing some thermal energy into the muscle and the connective tissue to make it more malleable, and then slowing down and challenging the infraspinatus. As the tone drops, you can see my fingers are tracing now a more longitudinal direction. The infraspinatus passes underneath the posterior deltoid and attaches onto the lateral aspect of the greater tubercle of the humerus. So I'm strumming through some tight deltoid fibers here. So we're just going to drop the tone in the posterior deltoid and the middle deltoid. And now we'll go again. Sweet traveling through the substance of the infraspinatus all the way out to its insertion in the greater tubercle. Still need to do some work on those deltoid fibers, so we'll get back to that. Maybe we'll put the arm in a more neutral alignment there, and then we can treat those deltoid fibers on a little bit of stretch. Now we'll go back. Check out the infraspinatus. As we go distally, see she's flicking less at the shoulder there because the deltoid is happier and more permeable. There are some really kind of shredded elements though in the deltoid that are going to be contributing to some shoulder pain. Sometimes when the rotator cuff muscles get tired, then the deltoid works overtime. So you want to treat the sits muscles, but you also need to treat the hard-working deltoid as well.